EMDR work. Something happens. As I mentioned a few moments ago, the example of Sammy running across the street. Something disturbing happens. Client either witnesses or directly experiences something that causes a level of trauma. And when we talk about trauma, it doesn't have to be this horrific experience. It can be that someone has a worldview or a belief system, how they see things. It's not necessarily a specific event that occurred, but it causes a disturbance in the system that affects their level of functioning. So EMDR unlocks, gets what lies beneath. So think of a Band-Aid. If you remove the Band-Aid, what lies beneath is a wound, something that can be healed. EMDR has the ability to get to what lies beneath. So the client can have the memory without the pain, can forgive the unforgivable. Because they can remember what happened, be desensitized to it, see it differently than how they used to see it, how they used to experience the world. The hemispheric processing, getting the brain back online, which has basically been shut down, because the amygdala, the alarm center, the hyperarousal that occurs when something that causes a level of disturbance that's beyond words, when we're talking about PTSD or severe trauma, it gets fragmented in the system. And so the body, the mind, the brain can't manage it, but it still exists. So EMDR, by its nature, by the bilateral stimulation, by the hemispheric processing, by getting to the wound, what lies beneath, can get there, can clear out those pathways, those channels that have been blocked. And a lot of times the client is not even aware of what happened until the brain, the system starts to come back online, until the dual attention stimulation actually starts to happen. And there's somebody there to witness, because we heal in community. And there's somebody there to guide them through, because they can't do it alone, because they're not conscious of what lies beneath. Laura Parnell's theory. If I was going to recommend a book, for those of you that are thinking of being trained or are trained, I would recommend two books. One would be this one, and they're also listed in the back of your manuals. But Laura Parnell's book, A Therapist's Guide to EMDR, is a wonderful book. She does a great job of really explaining well what EMDR is, how it works. It just makes it palatable, so it's also a benefit to share with clients. Robin Shapiro's book, EMDR Solutions, no relationship to Francine. Her first book, she's written two. The first one I really feel is the best. I think it came out early 2000. And she does a really nice job of gathering all the people that had been trained, like myself, from the beginning when Francine first started offering the training, of all the different ways that we use the modality, that we use the tool, and all the ways that we fine-tuned it. So that's a really nice combination of seeing a bunch of different EMDR therapists and how they use the tool, and you get different ways of using it in group and so on. So those two books would be the recommended ones. Robin Shapiro, EMDR Solutions, Laura Parnell, Therapist's Guide to EMDR. So Laura Parnell's theory, in terms of integrating what is happening, what can't be metabolized, she talks about that we can, with EMDR, it can be integrated, it can be metabolized, it can be palatable. Forgiving the unforgivable, memory without the pain. That the bilateral stimulation, hemispheric processing, allows those blockages to be freed, the information to be integrated, reprocessed, and filed. EMDR is similar to dreams. Now we know that with REM sleep, what's happening during those eye movements, we're trying to process anything and everything that's going on. The system is trying to come back online, but it gets interrupted. There's nobody there to guide. there's nobody there to witness. There is no healing community there. EMDR in the brain. So you've got the stimulation of the two hemispheres. With the dual attention stimulation, causing the reprocessing, causing the hemispheric processing, what happens is that the trauma, that when we're talking about trauma, especially in early stages of the brain, if trauma happens, it impairs mental, neurophysiological functioning. So EMDR is helping to repair what has been, not broken is not the right word, but has been separated, if you will. The long-term effects of trauma memory. We know that trauma memory is stored differently than ordinary memory. Fragmented, unintegrated. That, therefore, traditional talk therapy, is always sort of lifting the Band-Aid, trying to get to what lies beneath. And it does a good job, but if the client's not conscious of what that wound is, doesn't know all the details, we don't even know not all the details, doesn't know exactly what happened or all the emotions, the thoughts, and the feelings and sensations that are blocked or locked out because they couldn't put it into words. It cannot go into implicit memory, cannot go into narrative form. Then they can't really tell you what's going on until we start to get the system back online, until it can be integrated and filed. So we're born with implicit memory. Memory is stored in the right hemisphere in the emotional, behavioral, somatosensory, perceptual, and nonverbal areas of the brain. The infant has no concept of time, the past, the future, the present. Later we develop explicit or narrative memory, our sense of self and time. So if something happens, I'm talking about something happens to us now, like I trip and fall, I've got all this stuff all over the place, cords everywhere, I trip and fall, and I have these cognitive distortions, I have these thoughts, these feelings, these beliefs, these sensations. I can make sense of that. I can store that information. I can put it away and file it. Someone who's been traumatized in early childhood experiences, early childhood trauma, cannot, if they trip and fall, something that we see as minor, their level of hyperarousal, again, alarm center, the amygdala gets turned on. So a simple thing will seem so much larger for them because of that state of being that's pretty much constant for them, that symptomatology that we might see. The inability to self-soothe, to self-calm. Hippocampal processing. Awareness, conscious attention, focal attention, or working memory, then long-term or permanent memory. So from birth to 3 years, the hippocampus is immature. So memory is in the right hemisphere and implicit. With childhood trauma, the disassociation of the hemispheric processing, the fragmented states, somatic, the neurophysiological, the emotional and physical dysregulation, the information will not go into explicit memory. There's no words, there's no narrative.